So now we are going to talk about dissociative disorders. At the same time, I want to compare contrast somatic syndrome disorder. Dissociative disorder are a group of disorder characterized by feeling of detachment from reality and loss of memory. Let me recap it. Dissociative disorder or dissociative identity disorder, also known as multiple personality disorder. So it is called dissociative disorder is a disruption in integrative functions of memory, consciousness, or identity. Dissociative disorder is associated with exposure to an extremely traumatic events. So if you ask me what are the risk factors, usually patients give a history of psychological trauma. What is psychological trauma? Maybe abuse, maybe combat experience. So the person who have dissociative disorder, the most common sign symptom, maybe they give us dissociative amnesia or depersonalization disorder, and they maybe give us the dissociative identical disorder. So this is the type and cause of dissociative disorder. Before to go explain all of them, I want to tell you what is somatic syndrome disorder. So somatic syndrome disorder is excessive and maladaptive thoughts, emotion, and behavioral regarding the physical symptom that is significantly disrupt the patient's daily life. So it is not same as dissociative disorder. As I told you, the dissociative disorder may be dissociative disorder because of loss of self, dissociative amnesia. Individual has difficulty remembering the key information about themselves. What wrote? Loss of memory of a traumatic events. I told individual has difficulty remembering the key information about themselves. Then depersonalized disorder. Depersonalized feelings of being detached. So individual has a feelings of detachment from their feelings, thoughts, or action. Dissociative identity disorder means two or more distinct personality. So you see this picture, we put three. This is the man or female, one and two pictures. So means two or more distinct personalities in between one person. This picture, you see, so many faces we've left. Why? Because it's a distinct personality. What does it mean? Dissociative identity disorder, previously it is called multiple personality disorder. Individual exhibit two or more distinct personalities. Means one is just opposite others, but in same person. Right? Another is called dissociative fade, means loss of identity or travel to a new place. So what next? Next, little bit more. Dissociative identity disorder, also called DID, formerly called multiple personality disorder. Two or more fully developed, distinct, and unique personality exist within one person. The host is the primary personality, and the other personalities are referred to as altered. The altered personality may take full control of the client once at a time and may or may not be aware of another's. The altered may be aware of the host, but host is not usually aware of the altered. You understand? So when the problem start? So mental issue or mental disorder, basically they do not know about their character, no relation with reality. They have a false, fixed belief. If you ask me about the diagnosis, the symptom or history review. Symptom and history help to diagnose dissociative disorder, also rule out the underlying medical causes. So data collection, the client may have an inability to recall important information unrelated to ordinary forgetfulness. Transition from one personality to other is related to stress or traumatic events and is sudden. Dissociation is usually a method of distancing and defending oneself from anxiety and traumatizing experience. So next, dissociative dementia. As I told you, individual has difficulty of remembering the key information about themselves, inability to remember important information, personal information, because it provokes anxiety. Memory impairment may range from partial to almost complete. The client may assume a new identity in a new environment, may drift from place to place, develop few relationships, then return home unable to remember the dementia. So localized, the client blocks out all memory about a specified period. Selective, the client recalls some but not all memory about a specified period of time. Generalized, the client may or the client has a loss of all memory about the past life. Depersonalization, an altered self-perception in which one's own reality is temporarily lost or changed. So individual has a feelings of detachment from their feelings, their thoughts and action. So data collection say feeling of detachment, intact reality testing, intervention, develop a trusting relationship with the client, encourage the verbal expression of painful experience, anxieties, and concern. Explore method of coping, identify source of conflict. What else? Intervention, the focus on the client strength and skill, orient the client, provide non-demanding and simple routine, allow the client to progress his or her own space. Also, implement stress reducing technique. plan for individuals, group, and family psychotherapy to integrate dissociated aspect of personality or memory and expanding self-awareness. So before go the next summary, I want to tell as a healthcare provider, as a RN, what is our roles. We encourage to use a coping skill. Stress management is important. Also, grounding technique, and give them some group work or one-to-one exercise. So what are the summary? They said dissociative disorder causes the distress. A dissociative disorder can only be diagnosed if the symptom causes clinically significant distress or impairment in social or occupational or other important areas of functioning predominant. Common cause and sign of disease caused by dissociative disorder. So they said memory issue and dementia. We call dissociative dementia. Suicidal attempts. Sometimes they have abnormal thoughts and beliefs. Particularly, they have a history of psychological trauma. Abuse, and they said victimization. So maybe history of abuse, history of sexual assault, rape, or combat. So dissociative instructions. So what are the management they said? Instruction, flashback, self-injury. They have a chance of self-injury. Eating disorder, something common. Panic attack and anxiety common. They undergo depression or addicted to substance or alcohol use. So this is, they said this all of sign symptom also common in post-traumatic stress distress, which typically occur with dissociative disorder.